welcome to the Children's and Teen Health Summit. I'm your host, Carla Atherton, founder and director of the Lotus Health Project, lotushealthproject.com, where we empower people to get healthy and stay healthy in mind, body, and spirit, and on the social, global, and environmental levels. For this session of the summit, I am excited to be speaking with James Maskell about the evolution of pediatric care. James Maskell is founder and CEO of the Revive Primary Care, transforming health in America by combining a nationwide team of functional and integrative practitioners with a digital education platform. James is also the host of Functional Forum, New York City's biggest monthly meetup for functional and integrative practitioners that you can stream live or recorded on your YouTube channel. He's been spoken on 3 continents on platforms from Huffington Post Live to TED Med. Welcome to the summit, James. I'm so happy to have you here.
Thank you so much, Carla. It's a pleasure to be here with you today.
Great. Okay, so let's get started. Okay, so James, I am so thrilled to be speaking with you today about the evolution of medicine in relation to the health of our young people, as I truly believe that if we are going to pull ourselves from the spiral down of the health of our population and the explosion of health issues we have been seeing in numbers like never before, really, we need a new way of thinking about health and healthcare. So, James, can you tell me how you see our system functioning today and the problems we are facing with regards to health?
Absolutely. Well, I've become a passionate advocate for the evolution of medicine, and it's evolved over time. 10 years ago, I moved from my corporate job in England to America to work in the field of integrative and holistic medicine for a number of reasons. It was driven, first of all, by my childhood, where I was the weird kid at school, where I had a homeopath and a chiropractor. None of the other kids seemed to have that. My mum was very keen that I didn't have antibiotics. This was I was born in 1980. And so she was, I didn't realize that I was the weird kid until I got to school, and no one else had the same, sort of concerns as my parents. And then I went down the road. I did health economics. I became an investment banker, sort of a rebellious phase, I guess. And then I just realized at a certain point that I was playing for the wrong team and wanted to have an impact in changing health. And, potentially the biggest issue on the planet right now is healthcare and chronic disease. And if you look at all of the medical systems across the world, no matter whether it's, like Canada, single payer, or like America, where you have a sort of a private insurance system, all of these systems are having a significant amount of trouble because of the prevalence of chronic and autoimmune diseases. And it doesn't matter who's paying for them, as long as these diseases continue to grow at that size, we're going to have a situation where where these costs are going to get out of control. So I moved 10 years ago, and I've been working in the field and just over time evolving the way that I can have impact, and just become a really passionate advocate for the evolution of all medicine, but particularly kids' health, now that I have a daughter, and I've been involved with practitioners that are working with kids on the autism spectrum and other pediatric illness. And it's just caused me to do a sort of a deep dive into what's going on in kids' health. And the more I learn, the more I feel sort of frustrated that things are moving in the wrong direction, but also a sense of optimism that more and more people are starting to take control of their health and start to, start to pull out of the system and to be able to come to events like this to hear from people who are looking at new ways to be able to keep kids healthy.
Okay. Yeah. Awesome. So James, can you just expand a little bit about those frustrations of an evolving system like we have? Like you say, it's evolving. So maybe first talk about how you see it evolving. So where our starting point is and how you see it evolving, and then what the frustrations are along the way.
Well, yeah, medicine is evolving to meet the needs of the current patient base.
Yeah.
And when medicine was the kind of medicine that we have now was really designed for acute disease. It was designed for infections. It was designed for trauma. And, we've been trying to evolve it over the last 50 years to meet the new needs, which is chronic and autoimmune disease. Now, evolution is somewhat of a slow process. And one of the things that's been frustrating to me to see is that the distance between what we're doing now and what's actually possible keeps growing, because technology is really accelerating the potential for the evolution of medicine. And so what we see right now is that the difference between what we're doing now and what's possible is growing further and further. And so that's been a frustration of mine. And I've spent a lot of time this year, and I've given presentations and talks thinking about, okay, if we didn't have to evolve the system, if we didn't have to make our hospitals 10% more efficient, or if we didn't have to cut costs, if those weren't the focus, and we could just design a system from scratch, what would that look like? How could we design a system that was really designed around preventing and reversing chronic and autoimmune disease? And I think that system would look very, very, very different than the medical system that we have now. And that's the project that I'm sort of involved with and really focusing on this year and talking about, is really starting to start a conversation with different groups about what a medical system would look like if you started from scratch. And that's what I spend a lot of time thinking about. And I know that that's something that I think would be interesting, or is interesting, to patients, providers, and people who are concerned about the healthcare system sort of more in general.
Yeah, and that's a huge deal too, because when you talk about the evolution, like if we're working from this framework we have now, it's really it just isn't serving people. And so, yeah, when you say evolution, it's almost like, like a rebuilding, like, you said, starting from scratch. And so that's a monumental task, but definitely something that can be done, especially when, like you said, starting from scratch and just building it from where people think, or, that it's going to be the most effective, right? So I love that you're talking about that, because, and I love that you use the word evolution, because they're definitely something that needs to be done in that regard. So yeah, thank you, James, for that. And so you also too, why do you think pediatrics in particular is so slow to evolve?
Well, pediatrics, and probably for a very good reason, is the most conservative medical profession.
Right.
It's an extremely conservative group, which I think in certain ways has been valuable in the past, but I think is sort of holding back that evolution currently. And so that's been a big part, as you said at the beginning. It's really important that we. It's really important that we get this right with this group of kids for so many reasons. I mean, it depends on why you care, but let's just say from a financial point of view.
Okay.
So, recently an MIT researcher said that if the rates of autism increase in America continue, by 2025, we'll have 1 in 2 kids that are on the autism spectrum. So, I mean, that's a horrific thing to be thinking about anyway, but it's even worse if you start to think about the numbers that are required to look after a child on the spectrum. So they reckon that it costs $3.2 million for a lifetime of care for a child on the autism spectrum. So if 1 in 2 is on that spectrum, the numbers start to scale off very quickly to an extremely
astronomical
point. And that's just, financial implication. What about the social implication? We're also facing right now neurodegenerative disease in older people. And, that is an issue where it takes 3 people to look after someone with Alzheimer's. And so from a people point of view, there's not going to be enough healthy people to look after the unhealthy people. And so from whatever point of view you look at it, you could argue that we're actually devolving as a society. This is the first generation of kids that may live to a younger age than their parents, which has never happened before in human history. And so, the current group, the powers that be in medicine right now have overseen the greatest growth in chronic and autoimmune disease in kids in human history. And so that tells me we're seriously on the wrong path and we need to make changes very quickly. And that's why I've become so passionate about this topic.
Yeah. So do you think that we are so conservative about, in pediatrics because, we're afraid of like doing anything kind of changing or extreme relating to kids because we don't want to hurt them? Why do you think that is, that pediatrics is so conservative?
I think that's the baseline. I mean, it probably comes from a desire not to hurt kids. But here's a perfect example of where conservatism comes back to bite us is, say, antibiotics.
Yeah.
So we've done a great job in and this is the roots of an acute system trying to be an adapted for a chronic system. So antibiotics is the greatest invention of the 20th century. Really changed outcomes and lives, and significantly all across the Western world and the whole world, really. What an amazing discovery! What an amazing tool! And so you see the use of antibiotics growing, and you see life expectancy growing over the last over the last century. But then you start to see this natural limit where you can't keep using antibiotics. But we've trained society, we've trained mothers and parents to want antibiotics for their kids. We've trained parents that this is what you should do if you have, say, like any sort of infection. But then it turns out, one, antibiotics is not a good thing for a viral infection or a sinus infection. And furthermore, every dose of antibiotics is contributing to a significant reduction in the microbiome. And the microbiome is a huge topic that we can talk about shortly. But as more and more antibiotics are used and the depth and breadth of kids' microbiomes were reduced, there is a lot of evidence with the hygiene hypothesis now that essentially the allergies and asthma and pediatric chronic and autoimmune diseases are being driven by this reduction in the microbiome, and so we have to evolve that idea very quickly, because if we keep going down this route and keep giving kids multiple courses of antibiotics, it's a serious indicator of health reduction in the future and chronic disease in children. And so that's almost a perfect example of where conservatism in pediatrics has gone wrong.
Okay. So, and so when we were, talking kind of back and forth via email, we were wanting to touch on that, like what's wrong with pediatrics and kids' health. And you mentioned one thing there about antibiotics. Is there anything else that you can expand upon that will kind of give us, a good picture of what is going wrong here?
Well, I think the devolving is certainly, certainly something that that's a big problem, and that there are lots of examples with it. And I think when we start to talk about about sort of the solutions, you can see, I certainly feel attention spans and the ADD, ADHD issue is huge. There's a lot of biochemistry behind it. There's a lot of social factors behind it. One of my favorite TED Talks of all time, and I think the most popular TED Talk of all time, is Sir Ken Robinson talking about, education. I've also been very, very interested in the future of education now, just because I have a child now and I'm about to put them into an education system of some variety. And so, I think that there's a lot of issues that are driving, the problems here and the causes of those dysfunctions. At Revive Primary Care, we identified 4 main causes of chronic health issues that were modifiable by patients. One of our goals at Revive Primary Care was to inform and educate people about what is under their control. One of the things, and we'll talk about this evolving medical system shortly, is really looking at, who has the power in the system. The old system was very much a patriarchal system where the doctor was right, the doctor would tell you what to do, and you were just sort of sort of helplessly taking their advice. And that was, again, born of this acute system. If you get hit by a bus, you don't want to be in control of your healthcare because, you have a serious problem. This person can fix that problem, and you need to give them the space to be able to fix that problem, and they're the right persons to do it. Whereas when we're talking about chronic and autoimmune disease, when there's a lifestyle component as part of it, it requires that the patient be actually a part of the conversation. And so what we do at Revive Primary Care is we educate you on the 4 major causes of chronic disease. And so maybe it might be interesting to look at those 4 in order, because I think these are the things that anyone who's listening can start to take control in their own family. And one of the most exciting things that I've seen is the positive externalities of when someone takes responsibility. I've seen so many times that, someone has a shock to the system, like their kid gets diagnosed with something. It causes a change in behavior in them and in the family. Something shifts. Yeah. They see a good result. They continue that momentum. Then friends and family start to notice the changes within the child. And you get this sort of positive community effects. And that's something that I think we can build on. And that's what I'm really excited about, because those are the green shoots of success and sort of the evolution towards a more effective system where there's empowerment at the core of it. So maybe we could just take a moment to go through those 4.
Yeah, that'd be wonderful.
I'm sure you're going to have a lot of people that are going to speak about this, Carla, on your summit, but is diet and looking at that. And it's become so clear to me that this is a driver of current chronic disease for so many ways round. Obviously, the food system in America and in Canada is a mess, industrialized food, and certainly you can see that the food choices that are made right at the beginning affect behavior. I've seen for my daughter just how quickly she reacts to too much sugar, for instance. I mean, it's so obvious in her. I'm sure you've seen that as well. And that's just one example of where behavior is shifting so significantly from this food input, and that gives everyone a clue that food plays a major role in affecting function. And so diet is one area where we have a lot of leverage on influencing better health. So another area is toxicity, and this is a huge area as well. The same researcher that was saying that we may have 1 in 2 kids on the spectrum by 2025, she's looking into glyphosate, which is what you see in Roundup, and that's a pesticide. And, so we're seeing kids with levels of toxicity in their blood from being born. One book that I read when my wife was pregnant, which I would recommend to anyone who's listening to this, was called Having Faith by Sandra Steingraber. Okay. And that was an ecologist's view on motherhood. She's an ecologist, and she was talking about really the N=1 ecology of the womb. And, we're in a situation now where there's unprecedented levels of toxicity in kids before they're born, and that is bearing itself out as more and more chronic illness. So we have an opportunity when mothers are going through pregnancy and even before they get pregnant, where improving the detoxification mechanisms of the body and taking some time to be able to reduce toxic intake and improve detoxification pathways is a very sensible use of time. So diet and toxicity are the first 2.
Okay, James, what was the author called? What name? Sandra?
Her name is Sandra Steingraber, and the book is called Having Faith.
Okay, so number 3.
So number 3 is stress. We live in an increasingly stressful environment, and it's certainly become clear that stress is a key driver of not only chronic health conditions, and that's been heavily documented, but stress is also the number 1 driver of acute visits to the doctor. And so, that is, I think it's somewhere over 75% of visits to doctors are actually sort of initially driven by stress. And so, this is another area where, again, stress reduction techniques work, and there have been really effective ways that that practitioners have been done it. Actually, I have a friend who is developing a system in Canada to teach teach kids yoga in the school system. And so there are definitely things that are and projects that are recognizing that stress is a big factor and are trying to find ways to give all people, parents, families, and kids, ways to be able to deal with stress and to understand how stress affects function and to effectively manage it. So stress is the third. And then the fourth is immunity in the microbes. And this is what I was talking about earlier with the microbiome. And this is really new science. The Human Microbiome Project, the results of it came out in the summer of 2012. And if there was ever one learning, Carla, that would alert an audience or the world to the fact that we needed to take a more holistic view of the body, it is the microbiome, because the microbiome is the most interesting area of medicine in the fact that it's really sort of the forgotten organ of the body. It refers to the trillions of bacteria that are in, on, and around us all the time. And, we've had a poor view of bacteria and viruses because they, potentially were a cause of some of these acute diseases that our system was built on. But what we discovered in 2012 in the Microbiome Project was just how important it was that the body had a synergistic relationship with the microbes around it. And these microbes are absolutely crucial in digestion and in immunity and metabolism. And so, having a strong relationship with your microbes, having a mutually respectful relationship with your microbes, not killing them off arbitrarily, is a very important part of reducing the potential for chronic and autoimmune disease. Yes. So those were four areas where I felt like, these are causes of chronic and autoimmune disease that are modifiable by patients, and that patients could be empowered and could actually take control, of their health in these four ways. And, that's sort of like the, self-empowerment and patient empowerment is one of the starting points for an evolved medical system, because if lifestyle plays any role in chronic and autoimmune disease, and we know that it does, that really can't be, it can be, practitioners and doctors can inspire patients to change, but really the work is being done by the patients and the families.
Yes.
And it's not something that, medicine is not going to be, the evolved medical system is not going to necessarily be something that's always done to you. It's going to be something that is a partnership between provider and patient. And so here are four starting points for being able to understand, what is the optimal role for me and my family in this new medical system.
Yeah, and the word that sticks out in my mind of what you just said in the last minute or so was empowerment. With that's through education and through knowing your own bodies and understanding, what to do and having input from, providers, but really having that kind of empowerment to be able to make decisions and put those things into place in their lives. So, I think that's awesome. And to empower our children as well. Okay, so James, your work is all about evolving the healthcare system through Functional Forum, your summits, and Revive Primary Care. And so we talked a little bit about Revive Primary Care earlier, what you do there. Can you tell us a little bit more about what you do through Functional Forum?
Yeah, so, we started Revive Primary Care a couple of years ago, and the goal was to educate patients on the four major causes of chronic disease and then put them in touch with a functional and integrative provider in their zip code, essentially. We feel that functional and integrative medicine is a fundamental re-look at primary care. And my thought right now is that not a lot of value is delivered at primary care in our medical system. In America, typically you go for a primary care visit and then you just, they do a little, they spend 7 minutes with you and then either prescribe you a drug or send you on to an expensive specialist. So there's no real value that's being delivered there. And I thought, functional and integrative medicine really provides a lot more value. So we started that business. And then what we saw was that there's probably just enough of these kinds of providers, functional, integrative. Naturopathic medicine is bigger in Canada than it is in America, and I feel that naturopathic doctors are well positioned to be able to, to help patients because a lot of their fundamentals are built on the kind of fundamentals that you would want to build a system on. So, we started that, but then we realized we needed to have a conversation with those doctors as well because, there are a lot of things that we need to educate them on, not only clinically, but also in the emerging new business models for preventative medicine. We in America, we've seen that we've just sort of, again, tried to fit into the system that exists, and in that way have maybe not designed the healthcare models in the most effective way for incentivizing healthy behaviors. And so we started the Functional Forum as a way to get community and to develop community amongst practitioners in New York. And then very quickly, we decided that we wanted to grow it by streaming it live. And so now what it is, it's the first Monday of every month. You can watch it for free live on our YouTube channel, which is youtube.com/functional forum. We've got all of our archives there. But what we essentially do is we bring forward leaders in the field, clinically and practically and technologically, and sort of curate speakers across those fields. And we do, panels. You can ask questions live on Twitter. What we're really trying to do, Carla, more than anything, is to create a medical education that the doctors and practitioners wanted to watch. There's so many choices in how you get your, medical education now, different CME opportunities, but they're all, what I heard from practitioners from working with them for 10 years is that they sort of begrudgingly go to these conferences because they have to get their credits. And I was like, okay, there's going to be more and more ways for them to get their credits. Why don't we try and create something that people want to watch? And that's why it's an hour and a half. It's a bit more fun. We have music, we have videos, we only have short talks so that we keep the tempo high. And it's been really popular. It's grown. It's now basically the biggest professional medical conference because of the scale of the stream. We have thousands of providers watching every month. And, in my role as host, I just get to sort of curate those people that I think are doing amazing work and share that with a broader audience.
James, it's awesome. I have to tell you, it's fun to watch. It's very inspirational. I think we really need that to build community and, educate and, raise awareness, but also just to make the community part is to, work together and feel like, you're not kind of like this rogue on your own kind of doing this kind of thing. Like there are, people that are, banding together to turn this tide, right, of our healthcare system. And in particular, we're talking pediatrics here, but the whole family, the whole community as a whole. I think it's wonderful. So my hat's off to you, and it's really fun to watch. So check it out. Anybody who is interested in this kind of talk that's going on and what we're talking about as a new model. So that's going to lead me into asking you this next question that I have for you. I would just love for you to tell us what you think are the building blocks in an evolved system for pediatric care.
So next month, Carla, I've got the distinct pleasure of doing my first TED Talk. And I was approached by this guy after I did my summit. I connected with this guy who's in a little island called Guernsey. And Guernsey is a tax haven island between England and France. Okay. It's a tiny island of 65,000 people. And this guy is a very inspiring guy, but he's spent a lot of time looking, on the West Coast, working with the people in Silicon Valley and seeing the future of technology on that end. And then he also came across functional medicine. He heard Mark Hyman speak, and he really caught him that this was the future of chronic disease management with functional medicine. And, Guernsey is in a really unique position because, in America, my company, we're all about the evolution of medicine because we have to evolve the current system.
Yes.
There's a lot of people. There's like 900,000 doctors. There's a million nurses. There's a lot of people. There's a lot of. It's a $3 trillion industry. It's 17% of GDP. It's a huge thing. Now in Guernsey, they have a different situation where they have 65,000 people, so quite a manageable number of people.
Mm-hmm.
The average life expectancy is 85.
Okay.
And
wow.
the guy who's organizing this TED Talk said, we have a different situation here in that we could build a system from scratch without asking for permission. We could build a completely new system without any of the hospital or anything that we have right now. We could get venture capital to pay for it. We wouldn't have to ask for permission of any authorities. They've got the littlest bureaucracy in the world in Guernsey because it's not part of the EU and it's not part of the UK. So, he invited me to give a talk at that event called Designing Healthcare from Scratch. What would you do if you were designing a healthcare system today, based on what we know today? How would you do it if you didn't have to worry about evolving the current system? And that really got me thinking, and it was so exciting to think about that. It was very freeing to sort of let go of the shackles of, we're going to have to convince these doctors like this to think like that. What would you do if you had to start from scratch?
Wow.
So, that's the conversation that I've been really, really interested in. And so what I'd love to do today with your listeners, Carla, is just talk about some of those, because I feel like, a lot of this is outside of what we see as the current traditional medical system.
Yes.
And this is something that anyone who's listening to this can start to develop in their community. So should we start with the first one?
Yeah, let's do it. That sounds awesome.
So let's talk a little bit about community first. Let's start with community and talk about the value of community. And I want to give you, sort of a couple of examples of this. So if you were developing a system from scratch, you may want to think about the value of community. And I really want to talk first of all about peer-to-peer support.
Mm-hmm.
The medical system as it is right now is very much a top-down organization where you take direction from the doctor.
Yes.
But what we see, and that is good for acute disease, but for chronic disease, when you look at people who have chronic diseases, not only they want to hear from other people who have the same issues as them. Mm-hmm. And one of the most successful models that we see emerging is this group visit model, where instead of one person being seen at a time, for chronic and autoimmune diseases, you're seeing people in groups. Now, first of all, on insurance, it allows an opportunity for you to get a lot more value from the time. So you'd have a 90-minute visit instead of a 7-minute visit. Mm-hmm. And it could be just, billing on insurance. And this is being done, in America. But also there's this peer-to-peer support. There's accountability. My mother-in-law lost 110 pounds a couple of years ago. Wow. And the only thing that was different, Carla, the only thing that she changed, she changed some of her eating behaviors, but the biggest change was that she was accountable to someone else. Uh-huh. She had to call someone every day and tell them what she'd eaten and how the day had gone. And as soon as she had that level of accountability and community with someone else, then behaviors changed and everything changed for her. So, group visits is just one example, a clinical example of community. But they always say, and this is more pertinent to this talk, is it takes a village to raise a child. Yes. And, I really feel like there's so much value in community and peer-to-peer support. There's value in community beyond just a clinical setting. You have to think about what percentage of health, not healthcare, but health, mm-hmm. is actually delivered by doctors and medicine. Think about all the things that keep your family healthy. It's the friend who picks your kid up from school. It's your friend who brings you soup when everyone's sick. Mm-hmm. It's your grandparents who are looking after the kids because you have to go away. This was described by someone I met last year as wealth, WELLTH. Okay. And what he was passionate about was sort of quantifying this wealth and maximizing this wealth. And I think that is really the most powerful thing that we can think about that in terms of is community and what value your community brings to your health and the health of your family. Mm-hmm. And so, community is, I think, a building block of medicine. And I think that a lot of patients and a lot of doctors feel a sense of isolation. And I think that
Yes.
community is a building block of an evolved medical system.
That's huge. That's huge. And I mean, I just have to just jump in just for 1 second, just to second that, because I know that, if you have any sort of issues with your children, and you're one of those people, like you were saying at the beginning, where your mom was twigged on to all this stuff before a lot of people were, and still, aren't in some instances. And she, you were the weird kid. And so I have 3 weird kids, right? So it's really something else having to navigate that on your own. But once you're not the only one bringing the gluten-free dessert or less sugar at the, buffet table or to the sporting event, and more people start doing that, it's so much easier, and everybody else is healthy. Everybody's healthier.
Absolutely, yeah. No, it's huge, and I think in kids' health, it's even more powerful. And I think that
Yes.
that we've looked to create community amongst practitioners and patients and so forth, just because I think that, as the guru Thich Nhat Hanh says, community is the guru of the future, and I love that quote.
Mm-hmm. Thank you. Okay, so next.
Okay, so next is holism. I mean, holism and holistic, the word, when you hear holistic, it's been bastardized, hasn't it? Like the word holistic, that means very different things to different people. But I've got a great quote for you. And holism was actually first coined by a South African, Jan Smuts, in 1935. And his definition of holism was the tendency in nature to form wholes greater than the sum of the parts through creative evolution. I love that quote because it really describes it. And when I'm referring to holism here, I'm referring to a real understanding of the interconnectedness of systems. This is part of the evolved medical systems, that we can't view the digestive system and the endocrine system and the nervous system as in isolation. And my pediatrician and one of the, my daughter's pediatrician and one of the, biggest influences on my world has been Dr. Larry Palevsky. And he really talks about the inputs and outputs in kids' health. And you may have an input like a ton of sugar, and how is that going to be? What's the output going to be? It could end up in different kids, it could end up showing itself through affecting the nervous system or affecting the digestive system or otherwise. But what we have to understand is that seeing the body, again, in acute disease, it was useful to compartmentalize the different systems and to learn about them and to have specialists that focused on all of them. But if we really want to understand health, we have to understand how these systems work together. And so holism is a huge area that I think that we have to understand. It is the interconnectedness of systems and cause and effect. And the microbiome has really been the one thing that's happened in the last couple of years that has really stood up and said, hey, if you really understand the implications of the Human Microbiome Project, the fact that these microbes are really here to help and support us, and then having a healthy microbe can affect, that they say the future of psychiatry is in the microbiome, the future of immunology, it's definitely digestion and gastroenterology. So, skin issues are connected to the gut. It's all connected to the gut. And so here's a perfect example of holism. You can't just treat one part of the body in isolation. You have to understand the interconnectedness of systems. So holism is the principle, and I think the human microbiome is the perfect example of holism and why we can't ignore it.
Yes, for sure. And then we have, I just wanted to say that we really, this whole idea of holism, it just really requires us to be thinking all the time, right? This is our responsibility for our own health, and the empowerment that we can, employ is that we're always having to think and putting the pieces together for ourselves all the time.
Absolutely. No, for sure. And that's required. The third part, Carla, and I'm sure, as I mentioned before, this is something you're going to have a lot more on the summit, is food as medicine. This is a building block of the future of medicine is food as medicine. It plays such a huge role in the long-term health outcomes of all of us that we really have to get on top of this now. And I think if you the sort of Tom O'Brien, who was on my summit.
Yes, he's on the summit as well.
He's amazing, Tom.
Yes.
And basically every forkful of food that you have is either increasing or decreasing inflammation.
Yeah.
And the only thing that's neutral is water. Everything else is either adding to or taking away from inflammation.
Yes.
If we look at it from that angle, there's so much that we can do to improve health outcomes. How many doctors and alternative practitioners that I work with that have worked with families and have literally just taken, one child off sugar, off dairy, off wheat for a period of time.
Yep.
And the great thing about kids, Carla, is that it changes so quickly. The behavior changes and the symptoms can clear up. The body is such an amazing self-healing mechanism. Mm-hmm. And more often than not, all we need to do is sort of, Dr. Palevsky, when he spoke at my functional forum, he said we've got it the wrong way around, and I really agree with this. He says, people always ask him, how can we boost our child's immune system? Mm-hmm. And the way he says it is, look, the immune system is fine. We need to stop putting the roadblocks that are hurting the immune system. And it's a different change of thought, but I think that if we really think about it in that way, it's not so many like what herbs and what supplements can we get into these kids to boost their immune system. It's like, why does their immune system need to be boosted? Is because it's currently always under a barrage of sugar and milk and all of the stuff that is really inflammatory. And so this is, and the cool thing about this is that I've seen so many times, Carla, where unhealthy parents have learned so much from having a child because they see how quick things change in the kids. And they're like, wow, if this child is not bouncing off the walls because I start their day with protein and not breakfast cereal, how would my day be if I decided to, have protein in the morning instead of just, sugar? So, kids are a great learning experience and a great sort of petri dish to, to make these kind of changes. And, I think food as medicine is a huge part of an evolved medical system. And if just that one building block were brought into place, I think we could see, significant increases in the numbers that we want to see increased in healthcare and kids' health.
Awesome. Okay, next one.
So another building block here that we have to talk about is treating the cause. Yes. And this is actually a fundamental of naturopathic medicine, is to treat the cause. But we've got very, very concerned in medicine to treat symptoms. Mm. And I think that identifying the root cause of the problem and then treating the root cause of the problem has to be a building block of the evolution of medicine. It has to be something that we can build medicine on. And there are many examples of this, but, just going back to the last point, you give the kid too much sugar, the kid acts like it has ADD, ADHD, you medicate that kid for that condition. Yeah. That is not treating the cause. And you're getting into a situation where, where potentially, you're going to cause long-term damage from the kids because of the side effects of the medication. Mm-hmm. And so, we need to find a way to truly treat the cause. And so we need to have doctors and practitioners that can identify the cause of dysfunction. And then we need to have appropriate treatments that deal with those causes. And as I mentioned earlier, toxicity, immunity, diet, and stress are a lot of times the causes. And this is, again, another area where I think through all of these areas, technology is going to be a big part. And one of the areas that I'm excited about with technology is our ability to really become conscious of patterns of behavior that help us to unlock causes. Mm-hmm. And, we work with quite a lot of practitioners. I work with a lady who's developing, multiple programs, but one of them is what she calls data-driven coaching. And what she helps health coaches to do is really develop data from patients and track certain different things so they can really get clear as to, what's actually happening. Because think about it like this, Carla, you go in for an appointment with a doctor and a doctor maybe does some tests on yourself or your child. They're getting a tiny moment in time. This is a very dynamic system, the body, and they're getting a very brief moment in time where they're getting one piece of data. Yes. One of the things that I'm excited about this technological revolution, health tech revolution, is that by monitoring ourselves more closely with wearables and those sort of devices, or having some sort of way of of tracking data ongoing, we're really going to get to a point where we can really understand root cause resolution. And I think that we have to a building block of a medical system that's going to stop chronic and autoimmune disease has to treat the cause and not the symptom.
Yeah. And when you say treat too, it's almost like it doesn't even treat the cause. It more like it covers it up, right? Like it covers up the cause. And there was, I think one of the speakers, I can't even remember which speaker said this, but covering up the cause, or the cause is like turning off the alarm when the house is burning down. I thought that was so significant, because it's still happening underneath. And so if we don't, address it, what's actually happening, the mechanism behind these symptoms, then they just keep going and damaging our children's bodies, further and further until you have more symptoms and more symptoms. And so you're just covering up all the rest. And it's like, before you know it, there's all this illness, and there's really no way to, I guess, control or address the symptoms anymore because there's so many.
Exactly. Yeah, and that's why you have to have root cause resolution medicine, essentially, to be able to identify that. And that can be done through better diagnostics with doctors. But again, I'm always looking at ways that this can be done at home. And that's why something like an elimination diet, which I sort of hinted at earlier, where you eliminate certain inflammatory foods for a period of time and then add them back in slowly. That's like you being a detective at home and starting to work this out for yourself, because that's really important. And another thing that you have to look at with this with causes as well, Carla, and really the autism epidemic has put this into context, is that everyone is different. It's all individual. You could line 10 kids up with autism. They all have similar symptoms, and yet the cause of that dysfunction is completely different. One child, it's a complete dysfunction of the gut biome. In one kid, it's toxicity driven from the mother. Another one, it's toxicity driven from acute toxicity from lifestyle, or maybe from the full vaccination schedule in America, 60 vaccines over years with levels of aluminium and so forth that are way too high for a child. So that there are lots of different ways that it can spark, and what you also see is that the sort of prevailing new thoughts on autoimmune disease, for instance, is that it's environmental, it's genetic susceptibility, added to environmental impact. So you don't know, you could have the same environmental impact on a bunch of kids, and it may end up as different symptoms in different kids depending on their genetic susceptibilities.
Yes.
And so, this is why we have to treat the cause, and we have to treat everyone as an individual, and no one knows their child better than the mother.
Yep.
And so that's why the mother is a really important part of the childcare. And mothers, I think, have felt very frustrated in the last 30 years and maybe before, is that their information has sort of been secondary to whatever the doctor thinks, and the doctors haven't really paid attention to what the mother is saying in certain cases. But this is a huge part of the future of medicine is having more data, and mothers have more data about their kids than anyone else.
Yes.
And that's why they're an important part of an evolved medical system.
Yeah, and I don't want to use war analogies or anything, but really it feels like the mothers are in the trenches. They're the ones there. They're the ones experiencing. They're the ones that see all the action and know what's happening. For sure. Props to the mothers.
Absolutely.
Yes. Okay, so let's go next.
Yeah, so I'd say probably the next, and there's like more and more things that I think we'll see along here. But I think the last one that I'd like to talk about here, Carla, is as far as a building block for an evolved medical system, is inspiration and education. At the very core of doctor means teacher, if you go back to the Latin. And we've got very far away from that in the fact that, doctor hasn't been teacher, but there are much more effective ways than ever before to educate yourself. The scale. Imagine trying to educate yourself about these things in the 70s before the internet, where, there were a certain number of books, and you have to go and find the book, and you have to find out about the book, and then the book has to be shared around, and there's only one book, and, it's out of print, or, whatever it might be. There were so many limits on our ability to be educated. Now that we have the internet, there is literally limitless resources of information on any topic imaginable. And that's part of this empowerment, is that there is the information out there. And so, the thing about education and the way that it's going is that there are resources on everything imaginable out there, and what's important now for doctors is to inspire people to want to learn. That's really the focus of what I see as what education should be. And even if we look at education in the school system, remembering things and sort of teaching kids things that they have to remember is not that important, because for their whole lives in the future they're going to be able to bring up information because of the internet at a moment's notice. So what's really important is to stimulate the child to want to learn, inspiring them to want to learn, because if you can start that self-learning desire in them, then they will just learn. They will read, they will take on information, and so forth. And I think this is, education is a huge thing, because there's no limit to education now. My dad lives in South Africa. He works with refugees who come from, Somalia and some of the French-speaking parts of Africa. They all come to South Africa because they're looking for a better world. And he works with them. All of those people have a cell phone. Even the refugees in Africa have a cell phone. And so we're getting to a point where we have like almost universal coverage of cell phones, universal data. And so, access to information is almost at a point where we have universal access to information. And so what's not important anymore is what information. It's about inspiring people to want to learn. And I think, summits like this and other areas are really bringing information to people in a way that is empowering, and a way that that gives everyone the opportunity to know this information. And if you don't know the information, you can find out. And so I feel like that's a huge building block of evolution medicine, is that everyone's educated. It's not patriarchal doctor knowing everything and little mum knowing nothing, and them having that sort of relationship. In order for successful, healthy relationships, there has to be a mutual respect, a mutual understanding, certainly an understanding of the different roles in the process. The mother can't necessarily become the doctor in that role, but there's an adjustment of those roles and an evolution of those roles. And I think that a future effective medical system is built on inspired and empowered patients.
Yes. Yeah. Okay, so I'll just go quickly through those building blocks here just to reiterate. Community, holism, and one of the examples of holism was the microbiome and how important that is to the body. Food as medicine, treating the cause, and inspiration and education. Do you have any concluding remarks or thoughts about that, James? You've been so great at explaining everything so well that you may have said everything, everything you wanted to say here. But is there anything else you'd like to add for the participants in the summit here?
Carla, I think there's a real opportunity right now, to be able to. I'm very inspired by this phrase, Bucky Fuller. I have it on the bottom of my email, and it's to change something, you don't fight the existing reality. To change something, you build a new system that makes the old system obsolete. And that's what we're really looking to do with my businesses, is really to build a new system that makes the old system obsolete. And that is going to require everyone. And my feeling is that I see that there's a lot of people out there where they get struck with an illness. We just had our functional forum in January on cancer, and we had, if you can watch that, one of the speakers talked about the sort of the hero's journey that happens when you get diagnosed with cancer. And the hero's journey is a story that has gone through the ages. And what I see is that there's a lot of heroic mums out there. There's a lot of heroic kids out there that are getting faced with a diagnosis and then thinking, then what? This brings it into an acute moment of where they really have to pay attention to what's happening. And at that moment, you begin a new journey. Now, it may be a horrific thing. It may be a diagnosis of, a pediatric illness or otherwise. It may be something that you could never have considered. But I would just say that I have met so many people over the last 10 years since I've been in this field where that moment, looking back, was actually a key moment in them having the life that they'd always desired, a way to be able to help people, a way to be able to, connect their work life with their passions. I see that a lot in women and mothers where, 10 years ago, maybe you were either in the workforce or you were out of the workforce. And now there's all sorts of delineations, all sorts of gray areas between that where you can really build to do something that you're passionate about. And pediatric illness in a certain way is great for American medicine. And I have to, explain that because I feel that all of these doctors that I see that are switching to do more integrative and functional medicine, they have a moment in their world where something changes and they can't practice medicine the way that they have been.
Yeah. Yeah.
And so each of these potentially terrible moments can be in each family and in each person a moment of transition where you start to look forward to a new way of interacting with the world and a new way of going about what you do in the world. And I would just say to anyone who's listening that, this new system of medicine needs you to be a part of it. Mm-hmm. And it starts with taking care of your own health and the health of your kids and the health of your family. But the positive impact of you doing that on your friends and family and your community, I think that, you will be inspired to, once you've built that starting point within your own family, you'll be inspired and empowered and actually asked to have more of an impact in many different areas. And so I would just say that if you're listening to this and you're feeling down because, you're dealing with an illness in the family or you're dealing with kids that are sick, you may find that just changing your perspective on it and moving forward with that could be the shift that takes you into a whole new world that you never knew was possible. And I hope that this talk and this summit goes some way to be able to inspiring people to play a part in this evolution of medicine, because to change everything, we need everyone. Mm-hmm. And it's a ripe time to build a new system that makes the old system obsolete.
Well, James, you inspire me, I have to say. And I just want to mention the reference that you made to the hero's journey. That's Joseph Campbell's work, is it not?
It is, yeah.
Yeah, and so I would recommend to anybody listening to watch Finding Joe, which is a documentary about those very ideas. Just watch it every day. If you're feeling like you're alone and struggling, with these things that you were just talking about, James, Finding Joe is just a fantastic documentary to have a look at. Okay, so James, is there anything else you'd like to share with our summit participants about any of your current projects or where we can find you, your websites, anything like that?
Yeah, I mean, if you want to check out, one of the things we say is ask your doctor if the functional forum might be right for them. You can definitely watch the functional forum. It's on there. It's youtube.com/functional forum is our channel. We're going to have a lot of great content on there. And one thing that we're going to be offering in the future, Carla, is an opportunity for anyone to be able to develop a meetup in their local community for doctors and integrative practitioners. We're really looking to develop community all over the country. So if you're hearing this and you're interested in developing a meetup group for holistic providers and doctors in your community and being the center of that, this is one of the most exciting things that we're going to be launching. And, send us an email. Send an email to info@functional-forum, put meetup in the subject line, and we'll be in touch with you. This is a way for you to be able to put yourself at the center of the evolution of medicine in your zip code. And, what we're looking to do is use the Functional Forum as a monthly connection point, not only for the people in New York, but also for groups of practitioners all across the country. And I think that inspired and informed and empowered parents would be a perfect person to organize one of those events for so many reasons. And, that would be something that I think that if you heard this and wanted to get involved, we would love to hear from you.
Awesome. So info@functionalforum.com.
Yeah. Functional Forum, and just put meetup in the title, and we will send you the details.
Okay, and I would also suggest, I mean, not just for doctors to watch the Functional Forum videos, because I love them. And I think that, parents and caregivers can get a lot from them as well. So I would suggest that anybody go have a look. And also, you also mentioned one more thing that you did, like, did you see a summit about cancer?
No, we did. That was the last Functional Forum in January.
Oh, the last Functional Forum.
The Evolution of Medicine Summit I did back in September. The
Yes.
second one is coming up September 21 to 28 this year. And if you want to go back, that was evolutionofmedicinesummit.com. If you go there, you can see all of the content we developed there. There's so many ways to engage this content. I've really got into podcasts recently since I started doing my own podcast, and now I listen to other people's podcasts. It's very exciting that information is. Just remember the days when we were growing up, Carla. I mean, where in England there was only 4 TV channels and 4 radio stations. Now there's a limited number of information. You could opt out mainstream, and I got rid of my TV 5 years ago. Maybe that's one thing I want to.
I don't have one either. Woo!
Yeah. When I have a discussion with people about health or otherwise, I can tell where they're getting their information from. And I just feel like, think about what the TV is. Take a step back and think about it. You're basically paying to watch advertisements. The internet is awesome. You can watch anything you want to on the internet nowadays with all the systems there. There's no reason to have a TV anymore. And I think if you can make one change very quickly would be to just can the TV. I did it 5 years ago. My productivity went up. And now there are so many ways of finding the information you actually want to listen to, not just settling for whatever happens to be on the TV at that time.
Yeah, it's amazing what you can do with all the information out there. I totally agree. I did grad school with books piled up. It was only 15 years ago, and and just having to get all the books out of the dusty, everywhere and trying to find, and now it's just right at our fingertips. So thanks for bringing our attention to that, James. So I would love to keep talking to you, but I better let you go.
So upcoming, Carla, March the 2nd is our March Functional Forum, and that's all on the microbiome. So if you're excited about the microbiome, tune into that. Yep. And then April 6th, it's always the first Monday of the month at 8 p.m. Eastern. And that one is going to be on root cause resolution medicine. So if those 2 topics have piqued your interest from this, we welcome you to join us. It's free. You watch it on our YouTube channel. You can register at functionalforum.com.
I, for one, will be there. Thank you, James, for being part of the Children's and Teen Health Summit. I so appreciate your expertise, and you have yourself a wonderful day.
Thanks, Carla.